Hi everyone, I'm Dr. Laura Belus, naturopathic doctor at Holistics Naturopathic Clinic, and I wanted to share a few tips on managing asthma as well as lung function overall, especially during this cold and flu season. So if you suffer from asthma, whether that's something you were diagnosed with early on, maybe it's just exercise-induced asthma when you feel short of breath or wheezing when you're exercising, or perhaps it's brought on by certain allergens or cold weather. Either way, we want to support our lungs as naturally as possible and minimize the amount of medication or steroid inhalers that you are required to take. So let's start at the beginning. What air are you breathing in? When we are focusing more of being at home and spending more time at home, especially indoors during the cold and flu months, we've got to focus on our air quality. Now, most people in their home have a basic home filter that's, for most dust and allergens, but this is an opportunity to invest in maybe a higher quality HEPA grade filter or a portable in your room filter that you could just purify the air with in a certain area of the home, perhaps where you spend most of your time, living room or kitchen or in the bedroom at night, especially if you wake up or have asthma or difficulty breathing at night. So focus on the air quality and always talk to your naturopathic doctor about which air filters are best for your budget and your family. The second thing to think about are the foods you're consuming. Asthma is an inflammatory lung concern, so we've got to focus on reducing inflammatory foods. This also includes foods that are mucus producing or that can create a lot of additional lung congestion or make it difficult to breathe in general. And let's be honest, when most of us are exposed to colds and flus during this season, we want to do everything we can to not only improve our breathing, but keep our lungs reduced in terms of inflammation. So a couple of the big things that I recommend avoiding would definitely be dairy products during this time. Most of the time, for a lot of other health reasons, dairy products are usually a good idea to reduce, if not eliminate entirely. But if you suffer from asthma or breathing issues, you really want to think about getting rid of all dairy products. This can really help to, like I said, reduce congestion in the lungs and help you breathe a little bit more deeply. Another food category that can be inflammatory for some people with lung issues would be citrus fruits, things like grapefruit or orange. Usually lemons and limes are not as much of an issue. And this can create, again, a little bit more mucus and a little bit more of a congestion symptom that can make breathing more difficult. So always opt to eliminate these even for a few weeks to see how your symptoms improve. Now, what else can we do to boost our lung function and help our lungs feel and perform at their best? Well, we want to think about optimizing our vitamin D levels. If you have not tested your vitamin D, talk to your naturopath or family doctor about getting your levels tested. It's so important to know what your levels are now so you know how much to take in terms of your vitamin D. Sometimes one pill or the recommended daily intake of 1,000 international units is not enough when your vitamin D is already low. And the lower our vitamin D, studies show that increased issues with our lung function, whether that's respiratory issues from colds or flus or asthma. So really making sure your vitamin D levels are at their optimal level, and the only way to determine that is to test them first. Now, after you know your vitamin D levels and you've optimized your vitamin D, another thing to think about is vitamin C, as well as some bioflavonoids or antioxidants that help vitamin C work better. These are things like quercetin or N-acetylcysteine, or NAC for short. And these are great helpers with vitamin C to help reduce inflammation in the lungs, keep your immune system working well. But remember, even if you suffer from asthma, we want to make sure that our lungs are working very, very well and processing anything that might be irritating the lung tissue itself. So keeping antioxidants high is fantastic. And specifically when it comes to asthma, there's actually been some positive research on intravenous vitamin drip therapy and reducing asthma symptoms and overall lung function. So this is something you want to talk to your naturopathic doctor about, because intravenous vitamins can be fantastic, especially during the months where your asthma or breathing function might decline. Well, I hope those tips are helpful to get you started on your way to having improved lung function, and wishing everyone at home a safe and healthy week ahead.